My name is Lauren Carr, and I'm the Opioid Settlement Advisor here at CAECO. Each month, we try to bring together local, state, and national experts to highlight innovative and effective ways that Kentucky counties can use opioid settlement funds. Today, our focus is building sustainable recovery ecosystems by removing barriers that often keep the people from rebuilding their lives. Before we get started, just kind of remind everybody that we do have this webinar series, so I do encourage you all to register for it. For example, next month we are going to be highlighting regional, regional projects, the Northern Kentucky Office of Drug Control Policy and their Police Social Worker Initiative, and then the Barren River Area Regional Development District, their Anchor Project, which is a regional crisis mental health intake center. So be sure to register and join us for that conversation. Again, before we dive into the program, we have updated our resource library at CAECO. You can go there to find all things opioid settlement, whether that is how to do the new reporting, where to find approved uses. We do have sample examples of an MOU or RFP, and also all of our trainings are recorded and you can find that there. The second thing that I want to highlight before we start is the Opioid Symposium, which is hosted by the Kentucky Abatement Advisory Commission. It's going to be in October in Louisville this year. It is a great opportunity to learn how the state is using their opioid settlement funds and ideas and practice. DLG credits will be applied. They applied for that last year, and so they will be that for this year. So if you are looking for more learning opportunities, I highly encourage you all to come out to the Opioid Symposium. And again, also all these slides will be emailed to you that you can receive after this webinar. So recovery isn't about just overcoming substance use disorder. It's about having a safe home, access to healthcare, meaningful work, and a strong family connection. Programs such as civil legal aid and housing supports help make that possible by addressing everyday barriers that stand in the way of individuals in long-term recovery. When counties invest in these services, they're not just helping individuals, they're strengthening families, reducing the justice involvement, preventing relapse, and rebuilding communities. And yes, opioid settlement funds can and should be used for recovery supports. These are allowable, impactful, and absolutely essential in an individual's recovery. On your screen, you see a language from Exhibit E of how these funds can help individuals with an OUD, an opioid use disorder, substance use disorder, and it is really trying to reduce those barriers. I've seen that firsthand when I was working in direct client service. I knew a young man who had completed treatment multiple times, but kept returning because each time he left, he had no job, housing, no support system. And when he finally made the difference of just another rehab, it wasn't that. It was the peer supports that helped him stay connected, who helped him find a job, who helped him find housing, and most importantly, believed in him before he believed in himself. He didn't just survive, he has flourished. And that's what recovery supports do. They fill the gap between surviving and thriving, and they provide a connection to reduce stigma, help people re-enter the workforce, reunite with their families, and stay in recovery long-term. I'm excited to introduce the first of the two programs that we're going to highlight today. The first is Project Renew, and their legal aid work alongside of recovery programs break down the barriers and help people move forward. So I'm going to turn it over to Casey and Robert. Take it from here.
All right. Thank you very much, Lauren. Good morning, everyone. It's great to be with you all today. I want to we want to thank Lauren and Keiko for this opportunity to speak with you today. My name is Rob Johns, and I'm the Executive Director at Legal Aid of the Bluegrass.
I'm Casey Mikulovic. I'm a Project Renew attorney and the Project Renew project director at Apple Red Legal Aid.
And the two of us are here representing Kentucky's 4 legal aid programs. And every day across Kentucky, we see how addiction doesn't just attack health, it topples every part of someone's life, their job, home, family, and future. And the impact of this epidemic touches us all, the individual, the family, and our whole community. And it overburdens our city and county infrastructure and resources, including healthcare systems and police forces, and it limits our workforce. So we're here today to talk about Project Renew, which exists to stand those pieces back up one at a time, making justice and recovery possible for individuals, families, and communities. Next slide, please. All right, so what is civil legal aid? So Kentucky has 4 nonprofit civil legal aid programs serving all 120 counties in the Commonwealth. And the 4 programs are Apple Red Legal Aid, which serves the eastern and south central part of the state. Kentucky Legal Aid, which serves the western part of the state, Legal Aid of the Bluegrass, which serves the central and northern parts of the state, and the Legal Aid Society in Louisville, which serves Jefferson County and Louisville and the surrounding counties. And together, the 4 programs are the only providers of free legal services for low-income Kentuckians and other vulnerable folks facing threats to their safety, stability, or self-sufficiency. Important to note that we are not the public defender's office. We don't handle criminal work. A lot of times there's confusion about that. We are just on the civil side of things. We handle only civil cases. And civil legal aid services are available in your local community every day. And we offer legal representation, advice and counsel, and community education in legal areas, including healthcare and public benefits access, victims' rights, family law matters, including domestic violence, divorce, custody, and guardianship, housing stabilization, including eviction and foreclosure defense, consumer and debt issues, including bankruptcy, elder law, employment and education law, and expungement of nonviolent crimes. Next slide, please. Um, as you all know, Kentucky has been hit especially hard by the opioid crisis. We've had some good news recently with overdose deaths decreasing in the Commonwealth for the last 3 years, but there is still a lot of work to be done. Um, New data from a 2025 national report shows that Kentucky is one of only 4 states, along with New Hampshire, Nevada, and Massachusetts, where the rate of opioid use disorder exceeds 2.5% of residents ages 12 or older. I think the slides are a little bit ahead, but that's okay. You can leave it right there. Going to say a couple other things about the challenge. This challenge that we face is not only a public health emergency, but it's a financial crisis. That same analysis that I just mentioned found that Kentucky has one of the highest burdens of state and local costs per person for opioid use disorder, and that's estimated between $400 and $500 per resident per year, and that is far above most states. And according to the University of Kentucky's research, major factors holding people back from recovery include lack of transportation, not enough providers, and the steep costs of basics like childcare. And this crisis is tearing families apart and harming children. We have the highest rate of children in kinship care in the nation, largely due to opioid-related challenges faced by parents. And the crisis is also undermining our workforce. Opioid use disorder is estimated to have lowered Kentucky's labor force participation by as much as 3 percentage points. And that translates to the loss of tens of thousands of workers and up to $2.8 billion in annual earnings. And in addition, absenteeism and lower productivity have cost the state another $240 million each year, and that's according to the Center on Drug and Alcohol Research at the University of Kentucky. So tremendous impacts. I'm going to turn it over to Casey. That slide is good.
So this is where Legal Aid decided to create Project Renew. So we really kicked it off in 2022. I came on in January of that year, and the idea was to just try to start addressing any legal barriers that individuals may have in their recovery journeys. This could range from trying to get out of the cycle of getting a birth certificate and ID to needing an expungement or maybe getting a divorce that they've been trying to get for 20 years. It was trying to be that missing link in the recovery cycle to make it a little easier. Recovery is not, everything doesn't just get better when you finish your treatment. Life doesn't just magically get easier for someone. So our goal is to try to address as many of those barriers as we can in the most holistic manner possible to try to help someone in their journey address those issues and find a way to get not only through them, but be better when they get to the other side. In doing so, we tried to follow the SAMHSA guidelines in addressing the 4 pillars of recovery. So when you look at that, you've got the health, home, purpose, and community. And in addressing those issues, we tried to see what are the issues that people have that we can help with. A lot of times people think of legal aid as only helping with certain issues, a lot of family court issues, but there's so much more. So, getting access to your public benefits is so important. A lot of times when you're in active addiction, things fall apart and you lose access to your benefits because maybe you went to jail or something else happened. So that's where we're here to try to get people back in order. And then do they have somewhere to go? Do they have a home? What's that home life like? Are they in a dangerous situation? Do they need support, finding somewhere to go? Can we get them connected to a shelter? Because legal aid's not just about representing someone in court. It's so much more. It's connecting with them and looking at each person as an individual and seeing what they need. Because even if I can go to court with them and get one thing done, at the end of the day, if they're homeless and have nowhere to go, how much does that help them? So also trying to connect them to resources and other services in a way that's a warm handoff, as opposed to just saying, here's a phone number, give this person a call. You may not have a phone, but you can do it. So really it's looking at the whole person and seeing how we can address all of these needs. We do lots of expungements and also a lot of trying to help people find out how to get their driver's license back for all the things that have built up in the meantime. Next slide, please. So part of this work is really focusing on how we can help individuals get back to work, get them back involved in their communities, hopefully cutting down on recidivism and relapse by if we can make it a little easier for them by, making the phone calls for them up to the landlord that maybe, is trying to evict them or who turned them down for housing. Helping them address their custody issues. A lot of people are involved in custody custody problems while they're in active addiction, but they've completed their treatment and want to try to rebuild their lives, rebuild their families, and get visitation. So we're there to try to help them become not only self-sufficient, but reconnected to their families and their communities. Next slide, please. So just as an example, Rachel was a client out of, I believe, Kentucky Legal Aid. She'd been in active addiction for a long time. She was arrested. That caused a lot of other problems. She found out she was pregnant. Just went down the cycle that we hear so often. But she did go through treatment, but then after treatment, kind of like the story that Lauren was talking about earlier, life didn't just magically get easier for her and she was facing a lot of barriers. She was trying to get a degree, but she needed an expungement, and that's where we legal aid stepped in, and she was able to get help through legal aid through a partnership that we had with Goodwill, which helped her clear her criminal record, and then she didn't have to worry about the cost because of that partnership. So a barrier to expungement can often be the cost that people face once it comes time. You meet all the requirements, but then you face filing fees or other fees that may pop up. So she was able to not only stay sober but continue in that journey and get a social work degree. So she got her record cleared, she got a social work degree, and is now thriving, not just surviving, which is a major deal. The goal shouldn't just be to survive. We want to get people to where they want to be and to be their best selves. Turn it back over to Rob.
All right. So as Rachel's story shows, civil legal aid is not just some hopeful theory. Our work provides proven outcomes for people in recovery, and multiple studies have demonstrated that impact. Access to legal services leads to improved health and mental health, reduction in physical and emotional abuse, more secure employment, and greater long-term stability for families. And our own client data reinforces these findings. We've been really doing a deep dive into the impacts on our clients' lives. And individuals in recovery who have received our help are reporting improved finances, better health, stronger job security, and most importantly, less than 6% have any new criminal court interactions involving drugs. So our work is successfully supporting recovery. But with Project Renew, we're not just resolving legal problems, we're also measuring and documenting the real world recovery outcomes. We track information like housing stabilization, employment gains, reductions in recidivism, and family reunification. And these are the metrics that the evidence says matter most for breaking cycles of addiction and building lasting recovery. So for partners and potential funders, you should know that Project Renew is fully prepared to meet even the most rigorous new reporting requirements set up by the Kentucky Opioid Abatement Advisory Commission. And across all 4 of our programs, we already have the technology-trained staff and grant management systems in place that are needed to collect, synthesize, and transparently report high-quality data. And this means not just numbers, but stories of how civil legal aid changes lives, like Rachel's. So anybody that would fund or consider funding Project Renew should be confident that their investment would be accountable, visible, and result in meaningful impact. And we don't look at reporting as a task that is a burden. We look at it as a tool for continuous improvement and for deeper funder engagement. So Project Renew is evidence-based, ready for rigorous reporting, and proven to deliver the health, employment, and stability outcomes that Kentucky needs. Next slide, please. So national research from the Legal Services Corporation shows that every dollar invested in civil legal aid generates about $7 in social and economic benefits, the so-called return on investment. And those benefits come from reduced public costs, stronger family and employment stability, and healthier communities. And by preventing crises before they spiral, things like preventing homelessness, unemployment, and family separation, civil legal aid saves both money and lives in the process. And Project Renew stretches limited community resources by working alongside and not replacing the recovery and prevention services already supporting Kentuckians. And we fill a critical gap in that recovery process by addressing the legal barriers that so often stand in the way of lasting stability for people impacted by the opioid crisis. And I'm sure you all know this, and we see this regularly. For many in recovery, success isn't determined only by the treatment they receive. It's often threatened or derailed by issues, civil legal issues, that are potentially resolvable for those folks. And Project Renew, our attorneys, we tackle these challenges head on. We help parents in recovery regain custody or visitation, secure guardianship. We preserve access to health care and medication assisted treatment through legal advocacy. We reopen doors to work by reinstating driver's licenses and expunging records. And we advance housing stabilization to keep folks in safe, affordable, and lasting homes. And we make sure individuals can access the public benefits they need as they go through the recovery process. So I want to mention our work is really focused on long-term solutions, not temporary fixes. And by removing those underlying legal obstacles, Project Renew strengthens Kentucky's workforce. We reduce strain on systems like shelters and hospitals and foster care, and we support true lasting recovery. And you all probably have a sense of this, but for most folks in crisis who are already living in or near poverty, um, the idea of trying to hire a private attorney is just, it's impossible. The cost is too much. So what we provide with Project Renew, and without Project Renew, they'd have nowhere to turn, but what we provide with Project Renew is, for them, is a resolution of the legal issues and a clear path to justice and a real chance to continue rebuilding their lives and moving forward. Next slide, please. And back to Casey.
So practically speaking, how does Project Renew work? We are a part of the community to try to create a coordinated response. We're a little different than our colleagues at our legal aid organizations. We like to say we meet people where they're at. So, we don't expect our clients to be able to walk through our doors all the time. We understand transportation is a major barrier. Um, Income is usually not there. So you'll often find us in treatment centers, jails, recovery housing, um, specialty courts. We try to partner with drug courts and mental health courts. We have meetings at your SUD clinics. Um, we try to just do whatever we can to help people get the help they need from us in the best way possible. So our whole goal is to partner so that we kind of have our own little network with our, agencies and our community organizations to address the whole person and in the most holistic way possible. So we get a lot of referrals directly from community providers or clinics. We have medical legal partnerships now as part of Project Renew, which is attorneys dedicated to working with these clinics to try to address the needs directly during their recovery process. We're lucky that we got to expand that way. Um, just as an example of how it works in real life, John was one of my clients. So John worked for one of our partner organizations. He learned about, Apple Red services, legal aid services generally. He was in recovery. He'd been in recovery for quite a while, but his wife was not in recovery. She was in active addiction. It just got to the point where he decided he needed a divorce. He was working, but he was also working at a nonprofit organization. He didn't make a lot of money, not enough to afford an attorney. So he came to us. He got assigned to Project Renew, so he became my client. And in talking to John, I did a needs assessment basically with him, which is, I know you came to me for divorce, but let's talk about everything else that's going on in your life. So maybe there's something else you need help with that you don't know about, or maybe you didn't think to ask. Um, Through that, I learned that he was a convicted felon and had a record. So I went through it with him and I said, "Hey, you're eligible for expungement. Did you know that you could get rid of this? That I can help you with it?" So we started in that process, which takes some time. But also, I learned that he was a veteran, but he's never gotten any services, through the VA or anything like that because he didn't think he would be eligible for services. Luckily, I have a resource coordinator who was able to work with him, got him connected to VA, which is called being service connected. So now he has health care for the first time in his adult life. And at the end of the day, and now he's thriving. He was able to get his divorce, move on with his life, get health benefits through the VA because of his veteran status. And now he has a completely clear record. So he's looking to move up either in his current job or look for a different job. But he's also maintained his sobriety and he's doing well in his recovery journey. So it's really all about looking at the whole person and how we can connect them to all the resources they may need, even if they don't ask upfront for it. Um, because I mean, maybe not everyone on this call even knew what legal aid was or what we can help with. So if we don't offer, that, maybe they don't know to ask. Next slide, please. Um, just to touch on a little bit of what Rob was saying, we try to be as accountable as possible. So we have different funding sources for our work. So we always work to look at what we're doing, and also we want to see what the needs are, and we do a lot of oversight in that. What are we getting the most requests for? What have we had to turn people away for? Can we change that? What are our needs? And then we have lots of reporting. So we are fortunate enough, all 4 legal aids are recipients of the state opioid funding. So we've been working on that for a few years and the reporting on that, as well as our other sources. But we're always looking for more opportunities. Um, we always want new partnerships. The need with every part of this work, the need is always greater than what we have in terms of capacity. But we appreciate all investments, whether that's financial investments or buy-in from our community partners, because Project Renew can't do it without community partners. Clients can't always get to us, so we have to find ways to be able to get to them and for them to be sent to us through those referrals, because we want to keep doing the work. We want to help people in their recovery journeys. We address every person in a unique situation because no one's journey is the same as another person's. So we have to address them in that same manner. Not everyone needs the same kind of help. But the needs continue to grow. We don't like turning away people, but I think the numbers show that about 55% of people who apply for legal aid in Kentucky aren't able to get the help just because we don't have the resources available. We have been fortunate to grow Project Renew over the last couple of years. It started with just me as the only attorney in the state doing it in 22, but now all 4 legal aid programs do have it in some capacity in their organizations, which is really exciting to me. I told Rob the other day, it's like it's my 3rd child. It's really important to me, so I want to see it keep going. Next slide, please. So we'd love to connect with anyone who wants to hear more or learn more or find out ways we can help. We love to come and do expungement clinics or just give education, speak, whatever you need us to do. We'd love to be available to you to help with that. So all of our contact info is on there. The map is also on there. So if you're curious about what legal aid serves your county, it shows in the map, it's broken down. But let us help you help your community. If you haven't seen us out, let us know. We want to be out. We try to get out a lot and join as much as we can. But thank you so much for having us today.
Thank you, Project Renew. And we will have time at the end for questions. And so I just wanted to say thank you for sharing that incredible work. But next, we're going to hear about another powerful example of how counties can use their opioid settlement funds in a housing scholarship program. This innovative um, This initiative is innovative, but recognizes that stable housing is often the missing piece in someone's recovery journey. By offering scholarships to help cover rent and housing costs, counties can give people the foundation that they need for healing, find work, and rebuild their families and connections without the constant stress of where am I going to sleep tonight. This is another way that we can use opioid settlement funds to make a direct life-changing impact. So now I'm going to turn it over to the Western Kentucky Opioid Task Force, where I have Nathan Brockett, the Program Director of Turning Point Recovery Community Center, and Caitlin Krolanowski, the Public Health Director at the Purchase District Health Department, to talk about the program, why it started, and some successes that they have seen. Nathan and Caitlin, floor is yours.
Great, thank you. We're very excited to be here and yeah, ready to go. What about you, Nathan?
Always ready. Are you first, Caitlin, or you want me to?
Well, our slides aren't up.
Oh, okay.
Yeah.
Is this different than the slides that we had?
This is the slides that I received. Yes.
Okay. So I think you were sent the wrong slides. So let me if you want to share, I could present off of mine to save some time. Like where I can share the screen, I guess. Or Nathan, do you have the slides downloaded?
I have the slides pulled up on my end.
Okay. I'm sorry about that, Lauren.
If I can have there we go. All right. Everybody see that just fine?
Yes.
All
And Lauren, we
right.
will get these to you right after this. I am so sorry.
It's okay. It's okay. Thank you.
Well, there-
Alrighty. So the Western Kentucky Opioid Task Force started back in 2019 through a variety of different federal grants and serves the most western part of Kentucky. And so I'm Caitlin Herlikowski, and this is Nathan. Hannah.
Okay.
I think we're gonna be a little off rhythm. The Purchase District Health Department, our jurisdiction serves 5 counties actually: McCracken, Ballard, Carlisle, Hickman, and Fulton counties. But the Western Kentucky Opioid Task Force serves all 8 of the Purchase area plus Lyon and Livingston as well through our initiatives. And so I was previously the facilitator of the of the Opioid Task Force, and who was the person that was part of this grant and program development. Cameron is now our project manager of our Harm Reduction Hub and the Opioid Task Force. So he is on here right here, Cameron Burking.
And then I'm Nathan Brockett. I'm the program director of Turning Point Recovery Community Center. We're part of Four Rivers Behavioral Health and one of the 25 recovery community centers in the state of Kentucky. And I'm also a person in recovery. So, of course, I want to say thank you to Project Renew for your advocacy and support for people like me. So thank you.
Okay. So this was just Lauren's header. We can go ahead and move on to the next one, Nathan.
Okay.
Okay,
Gotcha.
so we have 2 models of the Recovery Housing Scholarship that has been developed between partnerships with Purchasers or Health Department and Turning Point. And so our first one is the Independent Living model, which is that housing scholarship that is funded by 2 different COSUP grants over the time that has been implemented. And then the Recovery Housing Sober Living model is funded through opioid abatement dollars. And works with recovery housing. You can go. So Purchase District Health Department was awarded the COSAP at that time grant in 2020 for $900,000. And as part of this grant, we developed and created a housing scholarship program so that we could put people where they needed to be to develop recovery capital. At that time, and as far as we know currently, there is not another program that really does this model. But we could be mistaken on that. We then expanded our model in 2023 and received the COSEP grant for $1 million. And as part of that, we expanded who could refer to the program, because the one in 2020 really was a pilot. And we also extended the length of the scholarship program in the 2023 model. Okay, so our goal really was to build recovery capital by supporting independent living. We wanted to put people where they could actually have housing, where they could work and where they could live, that they could be near other people that would be supportive of their recovery. We have a lot of housing and transportation barriers in our area, just like the rest of Kentucky. And so public transportation is really a barrier for us. And so we wanted to make sure that, you know, we're putting people where they can integrate and gain that recovery capital instead of, you know, just in specific locations. So, and a lot of things too is like deposits really price people out of housing. So, you know, you have all of your utilities deposits, your first and last month's rent. I mean, that is a lot of money for someone that is coming out of treatment or coming out of jail or, you know, just doesn't have any, you know, capital in that way. And so besides that, we wanted to make sure that our program had a map in which people would receive different wraparound services over time, so that we were building upon what we were doing so that they could maintain this, because you can't just put someone in a house and say good luck. You have to give people a bunch of different tools and support so that they know what the next steps are. And then as part of that, for continued funding, they have to meet and maintain all of our requirements of the program. Okay. So our requirements are that they have to submit an application, they're approved by our committee, they have to complete or be in a treatment program, maintain their peer support specialist services, and complete all of the goals and requirements. And so we provide, you know, all the utilities, the rental costs, but we also do financial budgeting, goal setting, resume building, and we have a tapered model in the 2023 model. So in the 2020 model, we did 3 months rent. So we did the first month and then, you know, all the deposits, second month, third month. And then in the 2023, we decided to do the first month, the second month, and then taper it to like 50%. As needed up to 6 months. And so some people need it for longer if they're pregnant or have children or something like that, and they have more needs there. And some people need it, you know, for a less amount of time. So we go based off of needs, but they're allowed to have it up to that amount of time. And so that's kind of how that the plan was developed between us. And I'm going to turn it over to Nathan to say how it's being implemented.
So, of course, talk about the implementation. So since this program begun, I've been a part of it since my beginnings as a peer support specialist with Turning Point. Also a very early recipient of the funding through the program. So this program has allowed me to have a safe, secure, stable housing for my family. So I've been able to thrive, as you guys have talked about, through this program. So I love it. Absolutely love it. All right. So the implementation, of course, as she had stated before, they have certain requirements that they have to meet before we'll fund them. So in the beginning, the person will apply for the Recovery Housing Scholarship. The eligible applicants will be people that have completed short-term, long-term treatment, are in certain phases of drug court programs, IOP programs. We've done SAP, trying to leave anybody out that might be able to utilize this. And then we've amassed a committee of people from different disciplines that service people that are in recovery. They built a committee, and every month we meet and go over these applications piece by piece and kind of see where they're at. If there's any recommendations to better bolster the application for in the future, that's where we'll either approve somebody to receive the funding, deny it if there's certain things that just aren't going on, or maybe postpone the individual with recommendations on ways to make their application better. But all of these recommendations will be things that will improve their recovery capital. And then once they're approved, an individual will go out and seek housing. We're able to assist these individuals in that process, because sometimes that can be a little trying to find open housing, affordable housing, and things like that. But we do our best to try to house people around here to where they'll have access to jobs, access to where they could get their medical appointments done, things like that, closer to their family. And once they find their place, they'll request the funding from us here at Turning Point, and we will pay for the, as Caitlin said, that tapered model will pay to help them get in, and then along the way help them build that financial independence. And also, gotta have furniture, gotta have dishes, pots and pans, stuff like that. So that allows them to be able to get the stuff that they need to thrive once again. And then once they have received that initial funding, in order to maintain that tapered funding, we ask that they still receive their peer support services and work on their treatment plans as laid out for them, and still be working on the recovery capital, of course. This isn't just a means to an end. It's to definitely enhance people's lives through this. And as I stated before, right here, it's just kind of a brief overview of the qualifications. So it's a pretty simple for people to be able to qualify, but they definitely have to do their work to get approved. And forming the committee. So in the beginning, we had a committee of quite a few people that meet monthly from different, like I said, different walks of life, different disciplines. But right here stated is where we have most of the representation from. So people that work in treatment, people that are clinicians, people that are on state level committees and things like that. So it's a broad range of individuals that are coming and voting on these people. And then the qualifications to maintain, it's just stay engaged, stay plugged in, stay working on yourself. That's the goal here, is because we don't want it to be, oh, now we have our own place, we have our own stuff, everything stops. I've made it, I've hit the pinnacle of my life now. No, we want to continue to allow them to improve and get better in their lives, and be able to maintain that stuff. We don't want to have to come over to legal aid, talk about an eviction. You know what I mean? We want to be able to maintain, keep everything going. And make sure that these individuals are living their best life to the best of their ability. So this is kind of my favorite part, talking about the challenges in the beginning. I love a good challenge. I'll be honest with you guys, whenever we first started the Recovery Housing Scholarship and we're in the community trying to get people to believe that, hey, there's a program that'll house people. What do you mean? Nobody really wanted to believe us. So in the beginning, when individuals was receiving this funding, we were boots to the ground. We were out in the community with the individuals, meeting landlords, advocating for them, and letting them know that they could potentially be part of this person's recovery success story. Personal experience, person like me, I've never had a place of my own. I had to have somebody advocate for me in the beginning. So being able to be with another person and say, hey, this is real. And if you allow them this step in their life, we're talking about retention. We're talking about, a rejuvenation of their family and their life and all these things that make a person whole. And so we'll go shake hands with landlords and convince them that this is a good idea, that it's a good thing to give people somewhere to live. And since doing that, we've made a name for ourselves. We really have. People know what the Recovery Housing Scholarship is now in our community. So now we have landlords that will call us and say, hey, I've got this apartment coming available. Do you have anybody that you might potentially be able to get in there? So not only is it a good trade-off to get people housed, but we're also pouring funding back into the community as well. So it's not just a one and done thing. And quite often on our bulletin boards down here, we'll have little pool number things on a piece of paper that our participants can call and get housing. So it's been a really, really good relationship with people in our community, and that way people can be safely housed. Now, is this you guys, or you want me to go through this one as well, Caitlin?
You knew it.
Okay, so just to kind of show the impact that we have had in Western Kentucky, we have housed. This is stable, independent housing for individuals. This isn't a Band-Aid. This is people being housed that could potentially be permanent. Like me. So 101 individuals. I did a little research this morning in McCracken County when we've done a lot of these requests. These are requests for funding for housing so people can get their children back. That is my favorite part of this program. I'll be honest with you guys. I love seeing the restoration of families. 32 individuals out of that 101 in McCracken County, when they received that funding and signed and put their name on the lease, they were able to have custody restored to them by family court. Now, if that's not good to you, I don't know what is. You know what I mean? I love that. That's so awesome. So, and also not just McCracken County. We're not selfish, just McCracken County, of course. Callaway County. We've housed 8 individuals. We've been working with local recovery residences in that area to kind of take that next step out of some of the sober livings they have in that area and give people more permanent housing in that area. And then Graves County, we also have another recovery community center in Graves County, Turning Point, that we've expanded, so we're able to make more of an impact in that area as well, to try to get more people housed. And then Marshall County, 2 individuals. Then you got Ballard County with 9. And we haven't had any in Carlisle yet, but I'm sure before too long we will. Don't worry. And Hickman County. So that's our really rural area around here in Western Kentucky. So having 3 people housing in Hickman, that's pretty cool. I think so. And then Fulton County, that's my old stomping grounds right there. We got pretty rural too. We've been able to house some people there as well. In Livingston County, we have 9 folks. So just to follow up with you too, and I shared with Lauren yesterday the final number of folks that we've housed with this program. It was 151, and Lauren, I just wanted to report since yesterday it's went up to 153. So we're actively working. We're actively taking applications. We're actively working with people, and just trying to make them better. You know what I mean? So Caitlin, I guess
Yeah.
on you, right?
And so I think on that too, I think it's important to know on housing is there's limited affordable housing in a lot of our areas. And so like that makes an impact. We did have the tornado that came through in Graves, and that took out a lot of housing in Mayfield. And so housing itself is a barrier, and they've done such an amazing job hitting the ground and finding affordable housing for everybody. It's been absolutely amazing. And we have actually done a pre and post survey about stigma around housing. And I don't have the results with me, and just it was a general community survey about like Narcan and housing and everything like that. And we saw a marked decrease in stigma around housing in the way that people were more willing to live around someone that was in recovery. So this is consistently also helping with that not in my backyard, because people are seeing it work. And that's a very important thing, because we need that independent living. We need people to have houses, and we need people to be accepted and get rid of that stigma so people can seek treatment and recovery. And so the way that we're evaluating this program is through recovery capital surveys. And so there is a survey that goes what recovery capital they have when they start and what did they have later. And so that data, we're still waiting for it to come through. And then we also have some data and surveys where we look at the recipients about 9 months later, after they're out of the program, and ask, are you still housed? And so we are entering into that phase right now on that second grant. And so hopefully, by this time next year, we'll have all that data out for everybody. But even preliminary data they are still housed in general. So we'll have that evaluation coming up soon. The second thing that we have is the McCracken County Opioid Abatement Funds were used for an emergency housing assistance program. And so the way that we developed this plan between Purchase District Health Department and Turning Point is that a local agency brought to us that there were a lot of people that really had needs with recovery housing bills, and that they did not have the funds to pay for their rent for that. And so they were seeing a lot of that. So we developed a partnership for that. And then during the course of that, they had a very big project coming up. So Turning Point and Purchase District Health Department took the lead on it completely so that they could focus on their other project. And so in this program is what we decided was that we would have $600 available to them over a 1-year period so that they could use it when they needed it. So we will also only pay in arrears. We will not pay forward with recovery housing. We will only pay those past due balances that they need, up to $600 over a year. And that's just to make sure, because sometimes people will pay ahead, and then they may have a reoccurrence and then they get kicked out. And so we wanted to alleviate, any of that where we have to request money back or someone has used up their whole scholarship, even though they are now homeless. And so we will only pay in arrears on it. And so through that, PDHD was able to assist 16 individuals, and Turning Point was able to assist 28. This is you.
Oh, sorry. Yeah. Sorry. Yeah. So once again, when it comes to the accessing this funding, we do a lot of work with folks in the community, a lot of work with folks that are in recovery residences, providing peer support. And some of these folks are also the recovery housing applicants as well. So I mean, we're working with them through this process, but once it becomes an issue with them being able to pay their own way, or maybe somebody has lost a job, maybe somebody's coming right out of jail and trying to find that temporary housing, they'll come and seek funding through us. They'll apply, and we'll kind of, see what's going on with them, like what's going on, because we get a lot of applications for funding sometimes, but we'll sit and we'll screen these individuals, and they need to have a letter from the person that kind of runs the sober living home there that they are in fact at risk of eviction. Not necessarily doing this to try to make people super comfortable, you know what I mean? But we want to keep them from being homeless for sure. So we get invoices and things like that. And then once their application has been approved, the Purchase District Health Department, Turning Point would work together and figure out, who's going to fund them pretty much. And we'll fund them up to $600 if needed. We try to give them the whole $600 right out the gate, of course. That way, just in case something happens later on down the road, we're able to supplement just that much more. And once we receive the check or the payment or something like that, we will make sure that the individual is still living there. We'll communicate with the person that is running the home, or whoever the responsible party would be in that manner, and make sure that we're not just paying for just a bill somewhere. We want to pay to help the person. That was definitely the goal, is to make sure that we're assisting that individual that needs it. And there's certain things that would automatically deny somebody if they, if the requester's income is 200% over the federal poverty line, or if we couldn't get the necessary paperwork to screen them, if they didn't bring those things in, or if for some reason that individual no longer resides at that place, we wouldn't fund it. So like I said, it's to definitely help that person that applied.
We also have a 24-hour emergency housing. So we put people up in hotels as well if they need housing before they go into treatment. And so if someone is planning on doing some sort of treatment, but they, need safe housing or housing near treatment before they can be, have their intake, we will put them up at a local hotel, both us and Turning Point. And sometimes one of the barriers is that people have dogs or something like that. So that will be one of the barriers sometimes when we're looking at the 24-hour emergency housing as well.
Yeah. And I wanted to add to, kind of wrapping back around the recovery housing part of it. I want you guys to know that this isn't just, we're just out handing money to folks, that we're legitimately working with these individuals. We are in that process of the peer support as Turning Point. We'll work on getting them their license back. We'll work on all these kinds of things, help them with jobs, to make sure these individuals can not only maintain their housing, but just maintain their lives. And, the driver's license, cell phones. We pride ourselves, with all those things. We pride ourselves at Turning Point is just kind of being the resource hub. And the thing about the reason I love it so much is because I am that person that I'm serving. I'm a person in recovery. I've had to go through these things. I've had to do all this stuff to kind of get my life back together. And it always seems like, as Caitlin said, that permanent housing is just that missing piece. And if we can get individuals with some keys in their pocket to their safe space in their home that they can return to, and then eventually here comes children, here comes marriage, here comes all these beautiful things that just make that person whole. And that's, programs like this are just so important for people in recovery. We all know that, as she said, it can get pricey, and we do our best to meet that need where we can.
And removing that stress of, am I going to get kicked out? Am I going to have someplace tomorrow? I mean, that does wonders for any single person. If you're in recovery or not in recovery, if you have, mental illness, that constant stress is just bad for you, and having something where you know that you're going to have stable housing and you can work towards a goal and not be like, am I going to get kicked out tomorrow? Whose couch am I going to sleep on? You know, will this sober living home help me? Like, that is an amazing thing to be able to give to people, and they're earning it. It's not like we're giving it to them. They are earning this through they are setting their goals, they are working towards it, they're bought in completely, and that's why it works. And the price tag on it per person is not as much as you would think it is either. So it's not like we're giving out $10,000 to one person over this time period. It's like around $3,000 in that mark per person, roughly, in our area, to get them into something where they're then giving back to the community as well. That's it.
That's all I got.
Thank you.
All I got.
As we close, thank you guys. And as we close, I want to thank our presenters for sharing their expertise. And thank you all for joining us. We do have a few minutes for questions. I see that there is a question in the chat, but I just want to set this that remember that recovery sports like legal aid, housing, and peer connections are not extras, but they are essential in someone's recovery. These systems make make it where recovery is possible and sustainable. So a lot of times, what we hope to do with this webinar series is share examples of what you all can do, but you also don't have to do this work alone. I'm going to drop our new resource library in the chat, and one of the things that we support is advisory groups. So advisory groups can kind of be that wheels on the ground to help find where these opioid settlement funds can come. So I see one question in the chat and the program about other regions. As far as for legal aid, they are in all 120 counties, but programs like the housing scholarship is going to be based on regions. But that's not to say that this can't be duplicated in your area, especially if you get community partners involved. As you see here, we have local health departments, and community mental health centers, recovery community centers, all coming to the table to help solve this crisis. So,
and I was going to say is if we're happy to share our model too. So if it is something that you want to implement, we would be happy to share our model with any person.
We don't reinvent the wheel, and so we learn from each other, and so however we can share and create this, so more people can have that long-term recovery and that sustainability. So if there is any other questions, we can take them now. If not, I will give you guys 3 minutes back of your day. Again, I just want to thank you all so much. I hope to see you all at the Opioid Symposium coming up. And together, county by county, we're building a stronger community and creating opportunities for recoveries that last.